What is a PCC? PCC stands for Patient Care Coordinator. For a hospice, the patient care coordinator is sort of like a head nurse or a manager, a nursing supervisor. We coordinate the care for all patients, or we're responsible for coordinating the care through the interdisciplinary team. So we make sure that the chaplain and the social workers and the nurses have what they need to provide care for the patients. There are many differences for being a hospice supervisor than an ER supervisor or a nursing home supervisor. Differences are that hospice focuses on quality of life and meeting the patient's wishes as possible, where ERs are looking at correcting trauma, repairing damage, maintaining heartbeat, sometimes at all costs, and without necessary regard to the long-term consequences of correcting that damage and maintaining that heartbeat. We go for quality rather than longevity. Nursing home supervisors are looking at rehab for some of the patients, or maintaining strength, weight, functionality of their residents. They're beginning to look at comfort care as a standard of care itself, but it is different than hospice in that they don't provide the bereavement care, follow-up, and they don't have extra staff when the family needs psychosocial support. Why did I choose a career in hospice? Well, I fell into it, I guess. I went into nursing to become a midwife, and discovered, having had 2 children already, that I really couldn't stand the obstetricians that I encountered in my nursing school clinical rotation. I ended up on this oncology floor. I fell in love with it. I enjoyed talking to people about what they wanted when they were first diagnosed and facing their chemo or surgery or radiation, and asking what their goals were and how they were going to get there. It wasn't being needed that got me into it. Some people think it's wonderful to be needed. I think it's greatly overrated. But it was to empower other people to do what they needed to do to meet their dreams, whatever they were at that point. If it was simply having somebody die at home, or being strong enough to go to a grandchild's graduation, whatever it was, to work at getting them there. So that's where I was in hospice. There's so many misconceptions. The 2 that I would really like to clear up. The first one is that it's the last days of somebody's life. The Medicare requirements say 6 months, or that a doctor has to state that someone has 6 months or less, given the usual course of the disease. But we can keep somebody on hospice as long as we can document decline, even if it's in tiny little increments. With this misconception, we end up getting people in the last days, and it's very hard to get people comfortable and to get their family at a stage where they're ready to reintegrate after the person's death. The second misconception is that hospice work is depressing. There are moments that are just heartbreakingly sad, but there are many moments of joy, a lot of laughter, and it is wonderful. It's very inspiring to see people step up to the plate and take care of a loved one in ways they had no idea that they could, to learn skills that they never dreamed they would learn, and to do that and keep somebody home, to make hard decisions, loving decisions. You get to witness an incredible amount of love and courage on these journeys. It's a great career. it's not for everybody, but that's the cool thing about nursing. There's something for everybody.